Hi, I'm Dr. Brian Quetman. I've been practicing bariatric surgery in Orange County, California for almost 30 years. When a patient comes into my clinic and says they've regained weight after bariatric surgery, I think the first obligation for the surgeon is to make sure that something hasn't changed with the anatomy. When we do bariatric surgery, the only thing we do is change a patient's anatomy. After that, we give the patient advice on how to make the surgery work, but the anatomy has to continue working in order for the procedure to work long term. Unfortunately, people's bodies do change, and some of the time, the change results in weight regain. So, the first thing that I do when I discuss weight regain with one of my patients or a patient that calls from somewhere else is I recommend that we go and evaluate their anatomy. The first way I do that is with an X-ray test that I've developed where the patient brings in cottage cheese or yogurt or something thick like that, and we mix it with X-ray dye. The reason I do that is I want to see how food goes through the stomach after the surgery they've had. Some of the time with a gastric sleeve, the size of the sleeve can be correct, but the food goes through so rapidly that the patient isn't going to feel like they need to slow down at all, and they're not going to feel full with small meals. When you have a gastric bypass, if the food goes through very rapidly, that just means that the opening between the gastric bypass pouch and the gastric bypass intestine is too big. And if the food isn't slowed down by the opening being the correct size and stay in the gastric pouch for a small length of time, then the patient will not feel satisfaction with eating, no matter how they eat and no matter what type of foods they eat. So the patient will regain weight in that circumstance, and it's not their fault. The problem is the opening between the stomach pouch and the intestine is simply too big. A lot is made out of the stomach pouch stretching after a gastric bypass. Very rarely do I think a patient is capable of stretching the stomach pouch. Over time, it might enlarge, but it's not due to the patient stretching it out from eating too fast or something like that. What more likely happens if the patient eats too fast is they start to complain of food getting stuck and having vomiting problems. And when they do that, then oftentimes it's something where they need to eat much slower. But if they're able to eat a lot more food and they think that the problem is they stretched out the pouch, it's either that the pouch has regained some size or the pouch was never the right size in the first place. Either way, the first thing you do when somebody comes in and complains of regain after weight loss surgery, whether it's a gastric bypass or a gastric sleeve, is the surgeon needs to evaluate the anatomy. When I evaluate the anatomy, I'm present at the time of the test. I make sure the test is done correctly and I read the test myself. And then I go over it with the patient and explain to them what we're looking at. And then I tell them what I recommend for revision. And if they decide they want to go forward at that point, they actually understand very clearly why they're having a revision and what I intend to do at the time of surgery. I hope that explains to you what should be done if somebody comes in after a gastric sleeve or gastric bypass and has regained weight. If you'd like to discuss this further, call my office and I'd be happy to discuss it with you over a consultation. All right, have a great day.